I'm very pleased to chair this distinguished panels. Let me run a quick introduction for the panelists. Dr. Trehan, it's a privilege to have you on the panel. You are a cardiosurgeon and you are one of the leading entrepreneurs in the medical sector in India. You have built one of the largest and biggest modern hospitals in India, providing world-class healthcare to patients from all over the world. A very welcome to you. Mr. Khosla, pleasure to have you as well. As a head of one of the India's new hospital change, you are playing a very important role in transforming India's healthcare sector. Thank you, and we will look also forward to your comments. It's a great pleasure to welcome also Mr. Zaid Siksek, meanwhile a good friend, being my regulator for many years. Zaid has been the CEO of the Abu Dhabi Health Insurance the CEO of the Abu Dhabi Health Authority, and now changed to the healthcare sector as entrepreneur. And I'm looking very forward to hear from you how you bring in the regulatory and the entrepreneur view. Just to give you a little bit background about medical tourism. It is globally a multi-billion-dollar industry. It was estimated that in 2014 it was around 100 billion for sure. I think the definition is very weak, so you can definitely pump up the figure if you like. We have seen a shift that the medical tourism was for a long time a domain of the developed countries. But now, as we have searched with the new digitalization and the industry 4.0, the technology is really becoming everywhere available, and it's more about the people in the sector and in the business to make a difference. So with the availability of human resource power in the new emerging markets, the industry sees a huge potential that also the developing and emerging societies will play a greater role in global health care. It is definitely the fact that people will make the difference. India and the UAE have already taken big strides in making specialized health care more affordable to patients all over the world. And Dubai has attracted, in the first half of 2015, roughly 260,000 medical tourists, generating more than 212 million US dollars revenues, and 46% of all these visitors are from Asian countries. On the other side, and that will, I think, be the interesting part of this panel, is as both the UAE and India are competing about and on the medical health care dollars from guests. There are still a lot of things where both countries can join forces, and I think in the 19th, in the management literature, there was a phrase of co-opetition. That means the cooperation among people who normally compete. We have already seen good examples where there was an intensive knowledge exchange between both countries, and this is where I believe that both countries will have a great future when they foster cooperation and they think where they can join forces in particular projects. Without further ado, I would like to start now with the panel, and our first speaker will be Dr. Naresh. He is chairman and managing director of Medanta. He is a renowned cardiosurgeon. He practiced in Manhattan, New York, before he returned to India to start Asker's Heart Institute in Delhi. He is truly an outstanding entrepreneur. I checked the website and I was really impressed about the things he developed and he put up. He founded the 1500 bed multi-super specialty institute near Delhi that offers cutting-edge technology and state-of-the-art treatment facilities at affordable cost. And being a health insurer, I like the word affordable cost. He has been decorated with the Padma Bhushan, one of the highest civil awards given by the government of India. I would like to invite you to join us and to give your thoughts to the distinguished audience.
Good morning, Mr. Chairman, my fellow panelists, and thank you, AIMA, for this opportunity to share the escalated progress of healthcare delivery system in India, which has actually caught on fire about 15 years ago and now has gathered pace, and we are growing at a CAGR of 15%. And it is predicted that by the year 2020, we will be a $250 billion sector. So for many years, the pharmaceutical industry in India has played well on the world stage by the generics and new molecules that they have been coming up. So much so that they are now the second largest makers of generic drugs supplied to the world. At the same time, for the last 40 years, the credentials of Indian doctors worldwide has been established. I was there for 20 years, but I would like to share with you that 17% of all super specialists in America are Indians. 30% of the NHS system is run by Indians. So, having known that the credentials of the skills and knowledge of the Indian doctor was already accepted across the world, we need to bring it back to India to see where were we in India, and that's how I returned 25 years ago. So, let me see if I got the right button here. Obviously not. which button is, oh, okay, that's easier. Okay, so what we did was, if you look at the way the healthcare sector built out itself in India, that primarily before the 80s, it was the domain of the government. We had some charitable institutes along with that. So the level of delivery, except for a few well-established hospitals, mainly in the government domain, there was very little quality of care available in India till the early 80s. Then what happened? That in the 2000s, the first step towards super specialty hospitals arrived. Apollo was the first chain, actually. They started in 84 and built out a few good quality, well run, current state of the art at that time hospitals which offered care to India. Then in 88, we established the first super specialty, single specialty hospital, and that was the Escorts Heart Institute. It was very clear that India was moving forward, but the future was not looking so cohesive to be able to compete with the rest of the world, mainly the Western world. So it was in 2003 that it occurred to me that India was not recognized as the country which had control over its own destiny in healthcare. And if you looked around in the Western world, there were institutions like in the United States, you name Harvard, Mayo Clinic, Cleveland Clinic, Stanford, John Hopkins. These were the institutions who were providing the highest end of healthcare, but also were the fountainheads of new knowledge. Albeit the knowledge that they were actually producing was for their own people and for their own economies. If you take that case point, if United States with 300 million people plus people, after spending $2.5 trillion, unable to give health care to their entire population, 60 million were always out of the loop and struggling for all these years, and you heard about Obamacare. And NHS struggling in the United Kingdom, where the waiting lists are so long that in some of the critical care you can't even get to a doctor. That for a country like India, which has 1.2 billion people, and our healthcare spend is dismal, how would we provide healthcare to our people? So one of the things that we said was that while we are actually pushing the front end, we also need to look at the bottom of the pyramid. And one thing that's when personally I felt that we should build the Mayos and the Clevelands of the East. That's how the idea of Medanta, the Medicity, came. After starting construction in 2005, we opened in November of 2009. And the salient features which were the required ingredients of an institution like the Mayos and the Harvards was that we create a system which is not just a hospital which delivers care to people, but it must have the whole ecosystem in tandem to be able to achieve that quality and to also create the new paradigm for our own country, for our own region. And we are standing on in the same region now, because we were all in the same boat. Then when what we did was to create that, you needed that infrastructure, which was 2.4 million square feet. With the infrastructure, which should have all the safety features, research abilities, teaching abilities, this structure was created in preparation for that. The second pillar was technology. That the technology should be as good or better than anybody who has, which is required to actually not only deliver that highest end of care that we talked about, but at the same time be able to chart our own future, do research, teaching, and develop the system. So if you look at it, there are very few people, institutions in the world that would have this kind of technology under one roof. But the most essential ingredient was the human capital. And the three things that we said for the human capital to be part of Medanta was that they must be benchmarked against the best in the world. They should not be the best in local, but they must be best in the world. Second is the point that they have reached a stage in their life where they are satiated and are willing to give of themselves, in other words, to teach and do research. And three, their ethics should be impeccable. There would be, because the distraction of ethics, money, so nobody touches money in Medanta. It's all collected by the hospital, and everybody gets their check, everybody is full time. After the taxes are deducted, we get our checks. So if you look at this, what I call the gallery of hoods, you would undoubtedly agree that this is a fantastic collection of people on the same platform. So the three ingredients became possible. Then we said, how do we function together? We do not function as our own specialty because the human body has all the specialties that are required in one form or the other if you look at the whole body rather than just one disease. So with that, the network between all the departments, all the institutions was established in a way that we would have a collective approach to patient care without. So patient was given only one charge, but he would have access to all the specialists around them, all the institutes would participate in the care. So if I give you an example just of the Cancer Institute, you can see that every subspecialty has a specialist who will take care of that. So it's not like one surgeon like it used to be that one oncology surgeon would do everything. But it's impossible in today's knowledge to actually achieve that excellence which is now expected by people. And not only that, if you're going to push the envelope of a country to the next level. So this is how the institution works. There are tumor boards, there are medical boards, there are internal medicine boards, there is what we call the heart team in cardiovascular, so that nobody actually is given or not given the benefit. Every patient has the benefit that if they come for their heart disease, a non-invasive cardiologist, an interventional cardiologist, and a surgeon will look at them and decide what is the best treatment for that particular person and their malady. So these were the kind of things that we established. While doing that, I said, we know that the way we practice medicine today, there are, modern medicine has some great values. It is effective 95% of the time, but while doing that, we do only three things. We either give poison, which is antibiotics, chemotherapy, whatever you have, or we cut it out and I'm the biggest culprit of that. We split open chest 20 times a day, every day. And the third is that we radiate it with the most powerful beam we can find to kill cancer. But it has no relevance to the human body. We do not use the human body to help us to deliver that care. Whereas if you look at traditional medicines, whether it be Indian, Chinese, or Unani, or wherever, they always use the power of the body to fight disease. So the question that begs is there out there a synergy which, if you work in tandem from what we know as modern medicine and what we know as the methodologies to boost the immune system or whatever system you can say. And now if you look at cancer research has now, after going through all the rigmarole, has arrived at the same point, that is immunology. The bulwark of cancer treatment today is headed towards immunology. That means you are actually identifying the actual reason why that cancer happened, what the body can do to boost the immune system to fight it, and in addition to that, whatever external help we can give. So this is where we feel that the money lies for us to create that new medicine. That new medicine, which will be an amalgam of all the things that we talked about, and hopefully it will achieve two things. One, it will be effective as any other medicine available today, including modern medicine, but at the same time less invasive, because we destroyed the human body on our way to finding that solution to that malady. And second, hopefully half the cost, because there are 4 billion people today who cannot access the kind of health care that we talk about. So do we have a responsibility as we move forward to do that? Switching gears, just to give you a little India, you can see the figures. These are the annual number of cases that we do at Medanta. So we do 6,000 plus heart procedures, 4,000 plus cardiovascular, the orthopedics, sorry. And then so on and so forth, including kidney transplants, liver transplants, neurosurgeries. So there is a huge array of clinical material that we have. And it's only natural that we take it as a great training ground for the future generations. Now coming to what benefits this has brought to India, we have a very large inward traffic for what we call medical value travel. And it comes in three circles. India has been traditionally the provider of healthcare to SAARC region, to the South Asian continent, which is, by the way, 2 billion people. And then, as I said, there are 2-3 billion people around us who need that kind of quality care that we just talked about. In my own lifetime, when I finished my training in the US at New York University, at least 300 to 350 Indians would come to America for their coronary bypass at that time, in the early 80s. Today, Americans come to India for the bypass surgery, so you can actually, the cycle has been completed in my own lifetime. That's the potential of our region. UAE is also moving rapidly in developing the facilities. Wherever the advantages are in the two countries, we could actually leverage them to make this region the hub for all future medical care. Because medical care today, where people used to travel, is still single approach. You need some cancer treatment, you go somewhere. You need heart treatment, you go somewhere. You need your joints replaced, you go to some place. Whereas we need to develop those comprehensive facilities that in our own region, we don't have to travel for bits and pieces, but that comprehensive care can be developed. It does not have to be too expensive. It can be created with efficiency, including if we have proper training facilities for our human capital, because the future will be dependent today in India with 330 30 plus medical colleges, we still produce only half the number of doctors that we need. So there are huge opportunities if we look at it between creating new facilities in both areas, collaborating on training, and most importantly, collaborating on research. If you look at it, this whole area in India and the UAE and the whole Arab world is full of diabetes. Diabetes is one of the worst diseases you can have. In some ways, even worse than cancer, because diabetes will destroy your whole body as it goes along. We have other maladies, coronary artery disease, gastrointestinal problems, in which we need to do huge research together. So the opportunity is there for us. And if we can use platforms like this to actually start that collaborative process, competing is, I think, is a misnomer here. We're all in need of it. So the question of competing is not the question. The question is to collectively develop that ability so that we can become the center of the earth for development of healthcare for this region, which, by the way, is 4 billion people, as I said. Thank you so much for this opportunity. Appreciate it.
Thank you very much, Rahul. That was very insightful. Trehan, sorry. The next speaker is Rahul Khosla. He is a seasoned multi-business leader with huge experience working in India and overseas. He is a very critical resource to the Max Group, as he shares the board of Max India, Max Life Insurance, Max Healthcare, and he is even some sort of colleague of mine, also being on the board of Max Bupa Health Insurance and Antara Senior Living. He's a astute strategist, and he has enhanced the financial performance and the organizational depth of the Max Group, and created a framework for the group to deliver great value over the long term. He has been also involved in very senior positions in the banking and financial service industry, as he was the group head of products at Visa for Asia Pacific, Central Europe, Middle East and Africa. And he was also the country head of ANZ Grinsley consumer banking business in India. It's a great pleasure to invite you and to share your thoughts.
Good morning. Thank you for having me here, my esteemed panel, and ladies and gentlemen. Dr. Trehan, thank you. I think it was a very personal journey that you took us through, and it's, I think, people like yourself and the institution that you founded that I think we have great potential with respect to what I also would like to call medical value travel rather than medical tourism. Because to me, medical value travel has much more significance, sincerity, I think much more accuracy to what we're trying to do here. So I'll keep my remarks a little bit more general, and I'm very glad that Dr. Trehan talked very personally about the institution that he's heading, because I think it's at a very neural level. Those are the kinds of capabilities that we have to leverage in order to be able to actually capture the opportunities for medical value travel. So what does it take? What does it take to create a hub? In generic terms, it takes a quality workforce, which I think for sure India has, even though we need to do so much more with respect to nurturing and deepening and widening the skills that we need in particular in this particular sector. You need a basket of services, not just good clinicians, not just a good institution, but I think you need an environment where patients who come for treatment are not just concerned with their own ailment, but they are concerned very much with the ecosystem that supports them. And I think that's where some of the opportunities, challenges and opportunities lie. It requires superior infrastructure of the sort that was just displayed. And I think over the last many years, perhaps a decade and a half, India has seen and grown a very substantial step, and has taken substantial steps towards building quality infrastructure. It also takes communication. If no one knows that you have these things, no one will come. And I think there is a sensible and responsible way of spreading the message through marketing and through sales, which is responsible, by the way, and not unethical, which we need to invest in together in order to be able to actually spread the message and communicate the capabilities that exist in this potential in this potential hub. It also takes a degree of regulatory and government backing, because without that, much of the ecosystem that is required with respect to making medical value travel grow is not going to happen. And we see challenges on that score, despite a lot of some progress that's been made, a lot of progress is yet to be made in this direction. And obviously it needs connectivity with respect to travel and ease of travel for patients and their families. So we stack up very differently between India and UAE, I think, relative to this. I do believe that India is coming to grips with some of the infrastructure challenges that they have, but much else needs to be solved. The one thing that has been solved is the quality of outcomes that we can promise. And I think some of these measures of success in terms of clinical outcomes and clinical excellence is now starting to gain ground in a much more broad way, which is very reassuring for people who come for treatment. Obviously, the UAE excels on infrastructure. I do believe that, and I actually agree with Dr. Trehan, that instead of fighting over the same patient, there is enough opportunity, because this region is still very under leveraged in terms of the penetration of the global medical value travel capability. And if we have $100 billion, which is spent, as Sven had said earlier, we're probably spending, no more than 2.5 or 3 billion in India. So there's a huge upside. And instead of fighting with each other, I think we need to know how to cooperate and combine our talents. India is relatively small, like I said, but still 500,000 people roughly, of which about half come for tertiary procedures. Main destinations being GCC, Africa, some of the SAARC nations, which is interesting. It's very tertiary demand driven, which reflects the clinical expertise and capabilities that exist in India. Though I must say that the market is fairly fragmented, and I think instead of it being somewhat of a cottage industry, time has now come where I think we need to put a concerted effort at putting together the pillars that it will take for us to capture the total opportunity for medical value travel. Obviously, for us, the 5 key limiters, first of all, is low connectivity. It's not that easy to get to India, particularly when you're looking at some of the Western markets as well. Our sales and marketing is relatively subdued. I mean, some of the examples that we see in Thailand have superb, infrastructure with respect to sales and marketing. We need to up our game and make sure that the message is out there. I think the absence of a comprehensive and bundled product. I mean, you have to assure soup to nuts, A to Z capabilities, whether that is relating to travel, accommodation, food, environment, hygiene, and so on and so forth, in addition to the medical facilities that you provide. And obviously, technical adoption, by which I mean we need to keep advancing our investments in research, keep advancing our investments in higher and higher technology to be able to provide the confidence to patients that they can come and be treated. And last not least, there are tedious government regulations, whether those relate to visas or visa on arrival or FRRO sort of regulations which need to be changed. So in essence, we do have the ability to attract the right talent. We have the ability in terms of infrastructure. We have the ability to provide the kind of medical treatment that we can do. I believe that UAE and India can certainly cooperate, and I think it's in the following 4 areas. One is in human resources. How do we take clinical talent and do exchange programs or learning sharing or success sharing, or even sometimes failure sharing, and saying, how do we learn from each other's experience and combine forces to be able to make this hub the most vibrant destination for medical value travel. So that's certainly one area. The second is in clinical management it's not just about clinical expertise, it's about how do you manage hospitals, how do you manage the business end of these things. And I think instead of, like I said, being a cottage industry, we need to graduate and make sure that we invest in the right architecture, whether it's sales, marketing, finance, pricing, across the board. How do we manage this business as a holistic business? Third, we need to lobby with the regulators to be able to make it easier for people to arrive, to stay, and to feel comfortable in an environment that is already fraught with tension. And last not least, we need to have exchange, a business exchange between ourselves in terms of communication and creating a platform that is common. So with that, I think there is a huge opportunity here in India for enhancing medical value travel, and also with respect to cooperating and coordinating with the UAE in terms of putting our best resources and capabilities on the table and combining them to make sure that we attract much more, particularly of the Western Corridor medical value travel opportunity than exists today. So with that, I'm going to keep my remarks short and happy to answer questions after Sven introduces Mr. Zaid. Thank you.
Thank you very much, Rahul. That was very insightful, and now it's a real pleasure for me to welcome Zaid to the panel. He's a very interesting figure because I think he was the chief architect of the Abu Dhabi healthcare regulatory framework and system. So he has introduced many very wise reforms and has built the system to what it is today. I would say a global benchmark. But he did not stay on the regulator side, so he saw maybe the huge opportunities in the healthcare industry, and he then decided to become an entrepreneur and is now heading a hospital group. And he is a biomedical engineer by training and has also a master's degree in healthcare administration, and hence he has really huge expertise in healthcare design, planning, implementation, and now also in managing its own facilities. Zaid, please join us.
Good morning, ladies and gentlemen. Thank you, Sven, for that kind introduction, and I'd like to thank my panelists for the very insightful views on their experience in healthcare. I can only learn from them. As Sven has introduced, it is right. I did spend a lot of my time as an engineer doing what engineers do best, which is to build systems and design architectural frameworks. I try to implement that in healthcare here in Abu Dhabi. And I spent a lot of my years looking at the dynamics of a healthcare system, trying to understand the various moving parts and creating something that would basically be different and that would take a hybrid of best practices that we saw from around the world and deploy it within one small ecosystem. I cannot compare it to the size of India, even if I tried. It's a very small, maybe potentially village, compared to the challenges that are with some of you. So I spent a lot of time looking at the difficulties and the challenges of our infrastructure, and I can relate to the previous panel when they said or gave examples of various proposals or various initiatives by which one could actually promote change, promote innovation, and promote outcomes. So we sat back for 1 or 2 years looking at how we could actually bring these dynamics together. And after having gone through a very wise 5-year plan, the most important thing that we actually, in my opinion, did is we stuck to the 5-year plan. We ended up delivering everything that we said we would within the 5-year plan. And in a health system, I think this is very important because there are many moving parts, and healthcare is probably one of the most complex industries I think that's out there, just because of its also organic change over time, whether it be in the discovery of new diseases, discovery of new procedures, the discovery of new medicines, or just the evolution of the human being. So one of the first things that we were challenged by is we never really knew what was out there in healthcare. We didn't know the challenges about in terms of how big and how diverse were our chronic diseases. We had many studies, but these were all extrapolations on small sample volumes or sample patients. So we didn't really know what the healthcare system needs were, and the relative transparency was limited. The data was non-existent. People were planning for healthcare based on a so-called perception on demand versus supply, whether it be in clinical procedures in cardiology, or it be in cancer treatment, or it be in diabetes. We knew we had a problem in certain chronic disease areas. The signals were there, but we didn't know exactly where these people lived. We didn't know what their age groups were. We didn't know whether they were male or female. We didn't know whether they were UAE nationals or non-nationals. So we spent a lot of time basically developing a system architecture which basically captured a lot of this in terms of being able to create that transparency. And the importance of that is something where I believe there is a room for mutual cooperation and collaboration between the two countries. The thing that we wanted to focus on most was to create from the get-go something that we were learning and educating ourselves about, which is what is referred to today as value-based healthcare. Value-based healthcare in simple mathematical terms is the outcome of quality over the cost. And value units are higher when your quality is higher at a lower cost. And I used to have the privilege of government sending me to Harvard Business School to go do courses on healthcare. And if any of you have attended any of the business case models, I found myself in a very interesting position where many of the business case models that were being reflected were actually cases in India, whereas we were in the US learning about the Aravind Eye Hospital or Dr. Devi Shetty's cardiac center, and we felt a little out of place because we could have gone to India. It would have been either both closer and less expensive. But indeed, value-based healthcare is the way to go. This is what we believe the next evolution for us in our country is all about. The reason why it's so important is also because of the current position that, or the current situation that we are in today. Number one, we have a huge advantage. We have a huge advantage to actually really set the stage for a transformational health system with the collaboration of many partners. Why I say that is because we've got actually a very small population. What we could do with the health system here will take other countries years to demonstrate. So it's a great breeding ground for the showcase of innovation, the showcase of development, the showcase of actually being able to deliver a value-based healthcare system. Total in Abu Dhabi, when I was introducing health insurance, and this was one of the few reforms that we had introduced. One, we broke the world record. Unfortunately, they don't put us in the Guinness Books of Records, but we did break the record. We insured the entire population, both nationals and non-nationals, within a period of 2 years. I'll say to the guys in India, try to do that. But we have an advantage. We only have 0.1% or a very small percentage of your population. So therefore, but by doing so, we were able to really then track every single individual in healthcare. Today, the health system is able electronically, with technology, to understand every single activity in healthcare by patient, by insurance card, by hospital, by doctor, by procedure, by cost. And this is a very powerful tool for a system that is gone from knowing nothing to now knowing everything in real time. And it is fantastic when we talk about infrastructure. That's the kind of infrastructure in healthcare that one needs. Although this is a great advantage, one of the few disadvantages that we still have, and there's always pros and cons, right, is the fact that this data now is a liability. We used to say we didn't know, so we will do our best. But the problem is now we know, because the data is there. And the analytics have to be used in order for us to actually make decisions on, or push the health system in the direction that are of need. The challenges that we still have in comparison to this wonderful system that we have created. And one asks me, Zaid, why did you stress so much on the system and its architecture? Because there are strengths that we have, and I can vouch for the infrastructure strength that we've got. But there are very big weaknesses that we also have. And our biggest weakness is probably the most important thing in healthcare, and that is human capital. Today, in the UAE healthcare workforce, 92% of the physicians aren't from here. 98% of the nurses aren't from here. So when we talk about value-based healthcare, and you talk about sustainability and all these great consulting terms about any system, what or however you describe it, there's always a challenge around how do you sustain a health system when you've got 98 different nationalities working in different elements of your healthcare system, and all have different educational backgrounds, and probably have never worked together for more than a year or two before they actually joined one of the UAE healthcare assets. And this is a huge problem because healthcare is all about the human capital. So what we try to do while we're trying to produce a higher percentage human capital or work with others on human capital, we try to create innovations around how to overcome these issues and these limitations. And some of the things that we have looked at include things such as standardization, whether it be standardization in clinical, what they call in the industry pathways, or clinical methodologies, or clinical management protocols as suggested by one of the previous panelists, and also to look at being able to focus on the areas where we have the capability. And you know what? Sometimes we simply cannot afford the capability. Let me give you an example. Bone marrow transplants. Very specialized area of medicine. Today, it's not just about having the human capital. We can afford the human capital. We'll get the best surgeons out of the world and pay for them, and they'll come out. Not all of them, but I mean a few select group of them would come out. And they'd work in our hospitals. But the problem is the other part of healthcare, like other industries, practice makes perfect, or practice makes permanent. If we don't have minimum thresholds of patients a year in bone marrow transplants, either we lose the physicians because they lose their skill sets, or we simply will go down on quality. And so the equation on value-based healthcare goes the reverse way, because our quality is dropping and our cost is pretty high. So we're not really creating value. Whereas if we look across the sea towards India, there they have huge volume. In fact, volume is a problem. And we could definitely use the resources, whether it be human capital or in healthcare delivery assets, that can actually help us overcome some of these challenges and put our dollars to the areas which actually make sense. So standardization in healthcare is very important. Looking at thresholds in certain clinical areas as a function of volume of clinical need is another very important aspect. Cost is also a huge element of the game. Today, we send about 2,500 patients, Emirati patients. I used to be responsible for this program all over the world. Due to the limitation in our specialty capability in medicine, or it be in the non-availability of certain specialties of care. Why? Because in certain clinical areas, I'll name one which I used to have a big challenge with, pediatric orthopedics, or pediatric orthopedic surgery. In the UAE, we don't have the volume to hire more than 3 to 5 doctors. So if any doctor decides to go home, we really need to figure out who's coming next. And if you want to double up, then that is an over supply of physicians, and the costs go high, and you minimize the volume. So these are problems by which have led us to spend about 2 billion dirhams a year just in Abu Dhabi, sending patients patients abroad for healthcare services, and we send them to Europe, we send them to Asia, we send them to America, based on various specialties. The most important thing for me in what I saw as a great opportunity for the two countries, or for the two establishments to really focus on, is integrated healthcare platforms. That is the way of the future, in my opinion. That is the way the UAE and India can really collaborate. Integrated healthcare platforms by which extended medical providers, especially within the private sector, coming out and actually benefiting from the system's infrastructure, but at the same time also be able to sustain a healthcare model which is of low cost and very high quality. And by the way, the distance between here and India is no further than going from Cleveland Clinic to New York. So the distances are equidistant if you think about it in terms of kilometers. Maybe even the trip is shorter. There is a problem with the infrastructure in some areas, has been described around visas and getting access, but I think bringing that access here is a very doable value proposition. In terms of capital, well, you know, the capital here is still abundant in comparison to some of the other places in the world. And these are areas which I think there is room for collaboration. The private sector, I think, is the way of the future. Where the governments are today and with the challenges ahead, I think the private sector will be heavily dependent on. And that was part of our strategy when we were transforming the health system. In fact, that was one of the main drivers or reasons behind introducing mandatory health insurance, where today 99% of the residing population is covered with insurance. Right? Last two things that I think are very important, at least as it relates to, in my opinion, being able to create disruptive change, and one is technology. Let us not underestimate what technology can do for healthcare, whether it be through telemedicine, or it be through diagnostics, or it be through consultations that can be done via the web and via the identification capabilities now that are basically today being provided at a handheld basis. People talk about the patient self-healthcare, or you see all these devices today being worn by all sorts of individuals who are either tracking their health or their calories or their steps. This is technology taking a step into personalized health care. And I think that today there is room for collaboration, and I don't think India is short of any technological capability which can really help in many different areas of the health system. Last but not least, in terms of our patients going to other healthcare networks, and what I can say is actually a decision-making paradigm for our patients is the patient experience. I know that there's a lot of talk in the industry about patient experience, but I think our patients are a little spoiled. They like the positive experience. You go to some of the Dubai hotels, they don't make any other hotels in the world seem as attractive. So we've spoiled our population in a sense, and they always look for that positive patient experience, but who doesn't? And I think this is also another fundamental element that one needs to take into consideration when looking at attracting patients, looking at ways of, being a differentiating provider from some of the other collaborators. At the end of the day, I think there is a lot of opportunity, and I think that geographic proximity and also the population demographic and the population mix that's within the UAE makes the number of opportunities larger rather than smaller. I would really love to take some questions to see what people may have in their minds as being the proposed challenges. I'd like to thank you for listening and wish you a good day. Thank you.
Thank you